Hi, Dr. Greg Mendel, your friendly anatomy professor, covering part 4 of the vertebral and artery series. We are looking at this drawing, which is supposed to represent the inside of the cranium. I will, before I get started, say I forgot to draw the jugular vein on this one a little bit ago. Jugular vein, there is no carotid vein. So, when we look at this, what are we looking at? We're looking at the skull. We have a carotid canal and a jugular foramen here. This is the foramen magnum. What we saw here was we have the vertebral artery and the common carotid artery coming up. The vertebral artery is coming out of the foramen magnum and joining with together and making another vessel. So what we have is the vertebral arteries on each side, but making the basilar, not a D, a B, basilar artery. The basilar artery is the combination of the two vertebral. We have an internal carotid artery on each side. So there are 1, 2, 3, 4 blood vessels giving blood supply to the brain. We have a vessel connecting. So we're going to make a U here, and these connect or communicate the right and left so that when blood comes in, it will be able to go to either side in case there's a clot or something wrong. Blood can flow, and we're going to see it eventually flow all the way around. This is called the posterior communicating artery. Posterior communicating artery, communicating both sides posteriorly. Does your blood need to get to the front of the brain, the middle of the brain, and the back? I would say yes. And so the part of the brain we're giving blood to is the cerebrum. So what we're going to do is we're going to draw blood supply to the anterior, the middle, and the posterior parts of the brain. Therefore called the anterior cerebral artery, the middle cerebral artery, and the posterior cerebral artery. All have blood supply. We're going to finish the circle of Willis with this structure in the front called the anterior communicating artery. Not cerebral, but communicating. And so we see that this communicates posteriorly, anteriorly, the circle of Willis. Blood can get all the way around all parts of the brain in case there's a little screw up in one area. Let's look at the blood supply inside here really quickly. The circle of Willis is here. Remember the 4 blood supplies. We have the vertebral arteries on each side. We have the internal carotid artery right there by my finger. The vertebrals come up and form the basilar. We have the posterior communicating in the back, blood supply to the front, anterior, middle, and right here the posterior cerebral arteries connecting in the front by the anterior communicating, circle of Willis. That is it for this video.